Tēnā tātou katoa, good evening. Medical researchers say we have a national scandal in our health system. They say every year around 5,000 patients referred by GPs to specialists will be declined services like surgery. One doctor told researchers they had to manage a patient into the grave because they couldn't get them specialist care. Investigations correspondent Michael Morra has this exclusive report.
Cherie Jeff's lips needs a new hip. This is not a revelation. She's been waiting for 2 years.
Everybody deserves quality of life.
While she waits in her Wellington flat where she lives alone, the pain has become unbearable.
It gets to the point sometimes of no return. You know, you just end up crying.
Cherie is on the official wait list for surgery, but was initially rejected after being referred by her GP as she didn't meet certain criteria. That rate of rejection and the impact on GPs was the focus of research at Otago University.
We've just come to accept this. It's really an indictment on us as a country. It's a national scandal, I think.
The research found between 2018 and 2022 there was a 5.2% increased risk of patients being declined specialist services after being referred by their GP. That means over that period, 17,500 new patients were rejected on top of normal decline rates, even though referral numbers from GPs were stable.
We would predict also, based on our research, that about 5,000 new referrals will be declined each year from here out if there aren't changes to the system.
The patients fall between the cracks because Health New Zealand only report on those on waiting lists, not on those yet to make it to the list.
There's a lack of transparency about the number of patients who have been denied access to specialty services.
And when patients can't get specialty care, primary care doctors are left to manage the fallout.
There is already overflowing demand for general practice. It is putting extra burden on practices and on practitioners across the country.
The report says GPs are put at significant risk managing patients with unmet needs. There's no additional payment for extra work, and some GPs knowingly don't refer due to the likelihood of getting declined. One GP spoken to as part of the research said he just managed one patient into the grave. He said he couldn't get her in to see a cardiologist, she deteriorated and then died. He says some patients get better, some don't, and some die. The doctor says that's not being dramatic, that's the issue. Brian Betty says he's had reports of people dying because they couldn't get care.
Certainly that quote from the research was a very real example of that happening.
The southern area topped the list as the area with the highest rate of rejections, followed by Nelson, Marlborough and the Lakes regions. The plea for all those missing out is likely the same.
Operate on us, please. Let us have some quality of life.
So she, like others, can get outside and get moving without perpetual pain.
OK, well, kia ora, Michael. What has Health New Zealand had to say about all of this?
Yeah, well, Health New Zealand acknowledges the concerns raised by GPs and the uncertainty that the delays to get accepted can create. It says it's working on improving its communication and its transparency around those waiting list times, and plans to set up what it calls a national data platform to get better understanding of patients who do not meet the criteria. So what is this criteria to get accepted? Well, it varies massively from specialty to specialty, and GPs say that's part of the problem. You know, Brian Betty believes the thresholds are too high, they often change, and he points out that they don't refer patients for fun, they do it because the patient has genuine need.
Great work. Thank you, Michael.